It is a mechanism whereby the body attempts to restore the integrity of the injured part. It takes places in three phases: the inflammatory phase, the proliferative phase, the remodeling, maturing phase. It begins immediately after wounding and lasts 2 to 3 days. It involves bleeding followed by vasoconstriction and thrombus formation. Platelets stick to damaged endothelial lining, a vessel releasing ADP which causes thrombocytic aggregates to fill the wound. When bleeding stops, platelet-derived release of cytokines from alpha granules, including platelet-derived growth factor, PDGF, platelet factor 4, transforming growth factor beta, TGFB. These cytokines attract inflammatory cells, neutrophils and macrophages. Macrophages have important role. They remove devitalized tissue and microorganisms. They regulate fibroblast activity in the proliferative phase of healing. It lasts from 3rd day to 3 week. It mainly consists of fibroblast activity with the production of collagen and ground substances, glycosaminoglycans and proteoglycans. Features unique to this phase are angiogenesis, formation of new blood vessels as capillary loops. Granulation tissue. It is a network of capillary loops and myofibroblasts. It is then replaced by increased type 3 collagen, giving tensile strength to the wound. It lasts for many months after the wound is clinically healed. It is characterized by maturation of collagen type 3 is replaced by type 1. Until a ratio of 1:4 is achieved, the scar becomes less vascular, hence the change in color. There is wound contraction due to fibroblast and myofibroblast activity. Maturation of collagen gives tensile strength in the wound. The tensile strength of the wound is maximum at 12 weeks post-injury and represents 80% of pre-injury strength. Tensile strength never equals to pre-wound